Year-round, I played a bunch of different sports and just love being around people who, not necessarily high-level athletes, but anyone who wants to be active and remain out on the field. My specialty is orthopedic sports medicine. I get to see a wide variety of people. It doesn't have to be an athlete, although I treat athletes all the way from young athletes up to the professional level. But anyone who wants to be out there playing pickleball, whatever it is that keeps them and makes them happy, keeps them active. I like to figure out what's going on with them and help them get back to doing the things that they love to do in life. I see pretty much anything in the shoulder, knee, or elbow is kind of my smaller specialty, and they come to me for a variety of reasons. Sometimes they've had an acute injury and want to figure out what happened, what to do next. Other times they've been dealing with chronic pain for any amount of time, days, months, years, and it's my job to help them figure out A, what is going on, what's wrong, and then what to do for it treatment-wise. I love to do surgery, but I only indicate patients when they absolutely need it. So I always start by doing a thorough history physical examination, get some basic imaging, and then I'll help them figure out what the diagnosis is going to be. I learned a lot about arthroscopy, or using a camera and small poke holes to do more minimally invasive type surgery. So when patients have certain issues that would be amenable to something like that, I always try to incorporate it when I can to avoid having to make large incisions and using smaller instruments to manipulate the tissues. The smaller incisions we make, it's a little bit easier for the skin to heal up. Also, if we have to manipulate less tissues to get to the area of interest, it can speed up the recovery a little bit, have a little bit less pain. Something I really enjoy about sports medicine is that it allows me to establish relationships with even young patients and follow them long term. So my goal is always for me to keep you out of my office, because that means you're doing well. But I'm happy to see people anytime for any type of condition, and I hope to build a lasting relationship. Staying active is important to me. I think you need to practice what you preach, so I get patients out there to be healthy and active, and I think that's an important part of life, so I try to do that as well.